Hello, my name is Lee Osler. If you have tried to effectively market to and get referrals from physicians already, you no doubt have experienced some of the problems and the frustrations that come with trying to figure out how to approach other health professionals. The videos and the other resources on this website will be able to provide you with important and timely information that will save you a lot of frustration and a huge number of hours as you prepare yourself and your team to work with and cultivate referrals from physicians. In the other videos on our website, we've already established the importance of understanding the science so that you can speak the language of physicians. In this presentation, we'll discuss the importance of using the right materials and how to package these together for maximum impact, as well as how to do it and save an untold amount of time in putting it together. One of the things that is for certain is that in any healthcare field, that the doctors have a tight circle of colleagues to whom and from whom patients are referred for care. These physician referral networks are very tight-knit groups, and getting invited into them is not always an easy task. Nevertheless, it remains a very desirable outcome and is almost always worth the effort. One of the goals of any physician referral program is to successfully become invited into these networks. The challenging dilemma is trying to figure out how to accomplish that. Having these business-to-business referral sources from other healthcare offices is a powerful differentiation and marketing strategy which will always help in a down economy as well as when times are good. The areas of the oral systemic connection, temporomandibular disorders and headaches, and dental sleep medicine all enjoy very strong research and clinical application, and they all provide dentists and physicians many opportunities to cross-refer and co-manage patients, and as a result, to grow their practice. We've learned that it is critical to understand the science so that you can speak the language of physicians, so that you can present yourself as knowledgeable and a good resource for the physician. Since each physician has an established referral network, it remains for us to answer the all-important question, just how do I get invited into a physician's referral network? We understand the importance of using the right tools and resources in physician referral programs. Without an organized system to position yourself, it can be a long uphill climb, as you'll see in a moment. When these are present and packaged together properly, it will greatly help you as you present your most important package, which is you. In the process of trying to develop physician referrals, it's important to understand that this really is a process and it will take time. I like to think of it as funnel marketing or drip marketing. Basically, we're putting a number of our physician colleagues to whom and with whom we wish to work into this funnel. We gently shake this funnel and do things with it and to it, hoping that the physicians will work their way through this system and emerge out the bottom end, providing referrals and co-management opportunities for us. Through this funnel, we're doing things to touch them, such as sending them letters, giving them newsletters, doing in-service presentations or personal visits, all the while improving and increasing the relationships. You will notice that this process involves the use of many different tools. Among those that we use in the physician referral program are a number of 3-ring binders, PowerPoint presentations, referral forms, newsletters, and other materials that help us in the process of reaching out and touching these physicians in the process. The cornerstone of this is the Physician Resource Manual. This is the calling card. This is full of the science, and we deliver it with something that breaks the ice, such as sweetbread, as you see pictured here, or brownies. Anything that will break the ice, be a little different, and get the attention. Inside, you'll notice from this table of contents from the oral systemic module, you'll notice that there are several sections here which deal with various specialties, such as cardiology, diabetes or endocrinology, pregnancy and cancer, and so forth. These can all be targeted to various healthcare professionals in your community that may have special interest in each of those particular medical subject areas. We also provide a science bibliography, which provides over 500 bibliography citations. The point here being, we want to come off as knowledgeable. We also employ the use of newsletters. This one shows a fax newsletter. We like fax because they show up and arrive in the physician's office without an envelope or a cover. The physician's name is stated on it, and obviously the dentist's name, and it's basically a science literature review that simply presents a few bullet points and puts my name in front of the physician one additional time. Ancillary websites can be put up, such as this one for oralhealthfordiabetics.com. These are each personalized for the individual dentist involved in the program, so that you can go out and accomplish patient education and branding in the healthcare community. This would be an excellent website to share with the diabetic learning centers, with the endocrinologists, and obviously with their patients and your patients. We also utilize PowerPoint presentations in the form of lunch and learn in-service training with the physicians, usually done in their office with their team. Pizza or other food can be delivered, and a nice social opportunity where you break bread with them, as it were. But the point is that we're going there to demonstrate our knowledgeable expertise and to build and increase relationships. We want to make it easy for them to make referrals to us. This referral form shows checkboxes that have problems, signs, and symptoms which the physician can refer to, and educating them at the same time while they're evaluating the patient. Part of the purpose of this whole program is to teach the physician what they should be referring, how they should find it, and to make it easy for them to make the referral. A very important part of any physician referral program in the office is the involvement of staff. Delegation must account for accountability. Vision and leadership obviously comes from the dentist, but we expect the staff and the dental team to be involved in this daily and managing the processes. In our next video, we'll talk about those processes and how we manage them using the physician relationship management software presented by MD Referrals.